Local and personal impact of Donald Trump's attacks on veterans. Donald Trump has spent these first 6 months in office making life harder for veterans. He has already ordered his administration to fire more than 6,000 veterans employed in our civil service. With service cuts and hiring freezes across our VA hospital systems, Republicans are making it harder for veterans and their families to get the care they need. What does this extreme Republican agenda mean for veterans in their day-to-day lives? Well, I will tell you. It means fewer job opportunities when transitioning out of the military and into civilian life. It means longer lines at VA medical centers and hospitals and crowded waiting rooms. It means terminated contracts or projects that would provide veterans with life-saving mental health care or even a roof over their head. It means making life harder on the men and women who have defended this country in uniform, who represent the best and the brightest of America. Today we will hear from leaders here in Virginia who are witnessing what these attacks mean on veterans and their families firsthand. Now it's my honor and pleasure to yield to Ranking Member Bobby Scott to begin this hearing here in Virginia's 3rd Congressional District. And Bobby, thank you for welcoming us to your district.
Well, thank you so much, Co-Chair Kelly, and I want to thank our co-chairs, Nanette Bergen and Debbie Wasserman-Schultz, who wanted to be here. I got a text from her late yesterday afternoon. She was at the airport. The plane had been delayed several times, and I think the last time it was delayed till about midnight. She might have gotten here at 2:30 in the morning, if that wouldn't made, but she wanted very much to be here, and so we'll see her at the next one, of course. I want to thank everyone for coming today. Today's hearing will highlight the ongoing attacks on America's veterans from President Trump, Secretary Collins, and congressional Republicans. We'll make introductions shortly, but I want to begin by saying that Virginia could not be better served by the leaders that we have here today in the room. The 3rd Congressional District of Virginia is home to the Hampton VA Medical Center, which is one of the fastest growing VA medical centers in the nation. With the main medical center and its 3 community-based outpatient centers, the Hampton VA Health Systems serves over 100,000 veterans across southeast Virginia and northeastern North Carolina, and it's growing. We expect at least 1,000 new veterans to sign up every day. The region is already home to about 300,000 veterans, and the VA expects a 10% growth in enrollees, a 10-year growth rate of enrollees of about 23%. In April, a new Chesapeake VA North Battlefield outpatient clinic opened, so veterans would no longer be required to cross from the south side to the peninsula for care. But regrettably, that clinic opened with less than a third of the required staff needed to be fully staffed to serve the veteran population on the south side. Only approximately 150 clinical workers were in place in April when the facility opened, when the full staff is meant to be at least 500. And this didn't happen by accident. In the first 100 days of his presidency, President Trump undermined the services at the VA by instituting a hiring freeze across the system. Then he squeezed our federal workers and fired civil servants across the country, including at least 6,000 veterans. More than 1,000 probationary employees were laid off in February, and the VA has said that they're looking to eliminate roughly 80,000 additional positions. And they said that no mission-critical position would be affected, but of course every position at the VA is mission-critical. What about food service or x-ray technician or any other person employed by the VA? Obviously mission critical. We had a situation where a scheduler for a dentist in one of the facilities was fired, and the dentist was having to do his own scheduling in between procedures. But every position at the VA is mission critical, so it makes little sense to lay off hard-working VA employees at a time when our VA system is feeling the strain of increasing demand. And meeting that demand is made more difficult because it's hard to recruit someone to sign up to be a probationary employee when major layoffs have already been announced. And to make matters worse, their so-called Big Beautiful Bill, or Big Ugly Bill, or as I like to call it, the Big Bad Billionaires Bailout, that squeaked by the House last month, slashes Medicaid, and we know that will harm everybody's health care, including our veterans. So that's the current record from the Trump and congressional Republicans: firing veterans, cutting services, weakening the VA, slashing Medicaid. Virginia deserves better. And so I look forward to the conversation that we're going to have today, and thank everyone for coming out. Thank you.
Thank you. In my congressional district in Los Angeles County, I'm very proud to represent almost 18,000 veterans who have served our country. From Hampton Roads to the harbor area of Los Angeles, veterans and their families deserve better than what Donald Trump and the Republican majority in Congress have failed to deliver, or more accurately, taken away from them. They are cutting services, they're firing veterans, and making it harder for my veteran constituents to get the care they deserve. These actions are extreme, they're unpopular, and unfair, especially when we remind the American people why Donald Trump and Republicans in Congress want to shortchange veterans' benefits and take their jobs. They want to make life harder on veterans so they can give another handout to their billionaire donors. All of us in this room and our entire House Democratic Caucus want to see Americans' veterans have access to good health care and more job opportunities. House Democrats, and I believe all Americans, want to make sure that we provide for our veterans and honor our commitments to those who served to protect and defend our country, our rights, and our freedoms. Thank you for hosting us here in our community, Ranking Member Scott. I look forward to this discussion, and now I yield to Congressman Thompson.
Thank you very much. I want to thank both the co-chairs, Kelly and Berrigan, for the hearing, and to my good friend Bobby Scott, thank you for your service to your district and for being a great member of the House. Thank you to the university and to the incredible witnesses that we have today. I'm Mike Thompson. I'm a Vietnam combat veteran, received a Purple Heart in Vietnam. I served with the 173rd Airborne Brigade. I am the founder and the co-chair of the Military Veterans Caucus. And like my colleagues here on the dais, I appreciate and I care deeply about our veterans. Thank you to our witnesses for being here. It's an honor to join you all for today's important hearing. The reason that we're here today in the first place is just downright shameful. This administration is failing our veterans. Since day one back in office, this president has gone after our nation's veterans. Since January, this president has fired over 6,000 veterans who transitioned from military service into critical jobs across our federal government. And he's begun to fire 83,000 employees at the VA. Meanwhile, the media has reported that some of those fired workers worked for the Veterans Suicide Hotline. Our veterans have a 57% higher risk of suicide than those who have not served. That's why we passed, and the President Biden signed into law the Bipartisan Compact Act, delivering crisis care to veterans at risk of suicide. It's unconscionable that this administration would gut services that literally save lives. And this administration isn't stopping at mental health services. The President is taking a sledgehammer to the PAC Act, closing the very office put in charge of these critical benefits for veterans who were exposed to toxic substance, including Agent Orange and burn pits. They're also crushing the morale at the VA, and they're scaring the hell out of veterans and their families. Not to mention, this administration has canceled hundreds of contracts that ensure that the VA can serve veterans, including projects working towards ending veteran homelessness. Make no mistake, by firing these veterans, this president isn't just hurting them and their families, he's making all of us worse off. The situation is dire, and congressional Democrats are stepping in on behalf of Americans' veterans. The stakes are too high. We have to protect veterans, their benefits, and the programs that they rely on every day. Programs and services that they earned. So thank you all for being here to stand up for veterans. I look forward to hearing from our witnesses.
Thank you, Rep. Thompson. We are joined today by Dr. Elliott, a pharmacist with more than 3 decades of critical service at the Hampton VA Medical Center, a center that provides health care and services to more than 50,000 veterans every year. Dr. Elliott is also president of Local 2328 of the AFSCME National VA Council, serving as a union leader advocating for VA employees and ensuring the very best of the workers who keep the VA up and running. As both a decades-long medical professional for the VA and a leading voice for its workers, Dr. Elliott knows exactly how Republicans are going after veterans and their health care. Thank you so very much for being here. And Sheila, you are now recognized.
Good morning. My name is Sheila W. Elliott, and I come to you today with over 42 years of experience as a pharmacist in Virginia, including over 35 years at the Hampton VA Medical Center. I also proudly serve as the president of AFGE Local 2328 at our medical center, representing the vast majority of direct patient care staff at our hospital. My comments today are strictly my own and do not represent the Hampton VA Medical Center or the Department of Veterans Affairs. I appreciate being invited today by the Democratic Steering and Policy Committee as a constituent of Congressman Robert C. Scott, with whom we've had an excellent working relationship for many years, both locally and nationally. AFGE particularly wants to thank Congressman Scott and all of the members here for co-sponsoring H.R. 2550, the Protect America's Workforce Act, which would undo Trump's executive order stripping collective bargaining rights from tens of thousands of federal workers, including those at the VA, by incorrectly determining that they have a primary function of national security. I will focus my remarks on the impact of the misguided policies on VA's workforce and its ability to serve veterans. Last week when I went to work, I was approached by 3 long-tenured employees, 2 of whom are veterans and retirement eligible. They are concerned for their future. One said, "I love my job, but the future here is so uncertain. I know how their work positively affects the functioning of the hospital. However, as they do not perform what VA considers direct patient care, they fear that they are on DOGE's chopping block, which highlights DOGE's broad view and unnuanced approach of how VA functions. The VA's list of employees that are exempted from the RIF's reduction in force illustrate that the danger of DOGE's tactics. Professions critical to veteran care have not been listed, such as recreation therapists. These employees provide therapeutic and diversional recreation services to our veterans who are confined to our community living center, also as known as the nursing home, and the domiciliary, which houses veterans for substance abuse and other treatments. Recreation therapists work with veterans to improve physical fitness, reduce stress, anxiety, ultimately leading to a higher quality of life. For example, recreation therapists play a key role in helping veterans with catastrophic disabilities re-engage in their communities. I have seen firsthand the impact of indiscriminate cuts on veterans' access to services. For example, the new North Battlefield Clinic, as Congressman Scott mentioned previously, was not able to open smoothly to care for veterans on the south side of the Hampton Roads Bridge Tunnel. There are 42,000 veterans on that side. Those plans were derailed when the initial freeze on federal employment was put into place earlier this year. Numerous patient care and other staff were told that their job offers were rescinded. New job announcements were canceled for every position. This chaos led many prospective employees to decide against coming to the VA. Who would blame them? Who would blame them? It's a great loss to our veterans. This disruption upended staff planning of our leadership that had worked on for 2 years prior to the clinic's scheduled opening. That is not to say that the VA cannot be improved and made more efficient. I have seen over the past 10 or more years a ballooning of administrative personnel at the VISN and VA central office levels, seemingly at the expense of frontline staff and the administrative staff they depend on. This expansion of management layers has led to confusion, staff turnover resulting in inefficiencies. Instead of focusing workforce reductions on those who directly impact veteran health and well-being, the VA should find efficiencies in areas that have less of an impact on patient care. Thank you for the opportunity to speak at today's forum. I do look forward to working with you to ensure that the employees at the VA in Hampton Roads and across the nation have the support and are empowered to best serve our nation's veterans. Thank you.
It's my pleasure to introduce one of Virginia's finest new leaders, someone who's been standing up for her constituents in the House of Delegates. Delegate Jackie Glass represents Virginia's 93rd District in the House of Delegates here in Norfolk. She is a proud Navy veteran herself, having served as a cryptologist for more than 10 years. And in Norfolk, Delegate Glass has been an integral part of this community and a fierce advocate in public service. It has been brought to my attention that she spent some time in the Chicago area, in the district now represented by our co-chair, Robin Kelly. But we could not be more thankful to have a leader like Delegate Glass in the House of Delegates. Jackie?
Gratitude to Congressman Scott, and gratitude to you all for the opportunity to speak here. As was said before, I'm Delegate Jackie Hope Glass, representing the 93rd District of the House of Delegates, and I'm also the Vice Chair for the General Assembly Military Veterans Caucus for Policy and Procedure. Yes, I am a veteran. I am a military spouse. I am also a mama raising military children. So I'm not just here on behalf of myself, but on behalf of every single veteran who has pulled me aside in the community, called my office, or caught me in the community to say, this system is failing us. Since taking office, I've had the privilege of deep conversations with veterans and folks across the veteran ecosystem about how the Commonwealth can better support them. Far too often, those conversations hit a wall because the root of the grievance lies at the federal level. Let's break this down. What's happened since the top of this year? There is a real growing threat to job and food security for veterans. There is a threat to rightful compensation for damage they endured while serving this country. And there is a looming threat to retirement and stability that many thought came with the government careers. This administration has dropped the ball, or not just dropped the ball. They have threatened the mental health and well-being of veterans and their families by intentional destabilization and a stunning lack of accountability. They are dismantling systems we depend on and replacing them with chaos. And I can say this, is that I know chaos when I see it, because I've kind of lived it. You see, as a naval cryptologist on board the USS Nimitz, I experienced, like many deployed sailors did, a fallout, or what was called a optimal manning experiment. It was sold as this cost savings efforts to do more with less, shrink the crews, reorganize the workload, bring in contractors, lean on technology. But what actually happened, readiness declined, maintenance backlogged, morale collapsed, skills gaps widened, human capital and capital mismanaged and crushed. It crushed efficiency. It crushed us. Does this sound familiar? I'm at a point in my life personally where my spouse, who is also a Navy veteran, has a federal job as an air traffic controller. Every week before he leaves for work, he says, let's hope I still got a job by the end of this week. As a legislator, I'm only able to do this work because my husband has a good federal job. I'm not rich as a state legislator. What is happening has ripple effects to the military family, to the military and veteran families. Most spouses get into lines of service. They are our educators, they are our social workers, they are working in our community. The other tripling effect is to the military child. Will we be able to send our child to school because of dismantling of programs? We depend on Yellow Ribbon to make these things happen. Outside of those issues that sort of are collapsing and hurting veterans and their families, there's one issue that keeps coming up like clockwork: health care. Not the idea of it, but the constant fight for it. And let's level set here. When you're transitioning from being the property of the United States to being a citizen of it, everything changes. Self-care, mental health, emotional and physical, was never a part of the mission. If you were sick, if you were injured, or not mentally dialed in, you were seen as a problem. So when a veteran makes the decision to care for themselves and their family, that is big. It is brave. It is also an exhausting move. The system is now punishing them for that. In Norfolk, just since January 1st, 2025, I've heard cries directly. Appointments canceled arbitrarily. Screenings indefinitely delayed, like high-risk breast cancer patient who can't receive the timely screenings. Fewer and fewer providers are accepting TRICARE now because of untimely, inadequate, or non-existent compensation or reimbursement. One veteran just mentioned this year, none of my medical bills have been paid. I am sitting with over $150,000 in bills. TRICARE hasn't sent one explanation. This is terrifying. Another was told that pre-authorization care was denied because service could be done at a naval hospital. So now we're leaving veterans to compete with active duty members for care. Another veteran went to meet a new primary care manager and was told flat out they were not going to be seen. And in that veteran's words, we are officially back to the 1990s VA. Another one was told by her caseworker that she has over 100 veterans on her log now. So she does not expect to hear from her soon. The first Mondays of every month, I meet with multi-generational, multicultural veterans at a local shop, and told them that we were coming here today. One of them said something to me that is very stark and telling of the position that we're in right now. He said, you know, we're like used cars. The military drives us hard, and when they're done, they toss the key to a new dealer and walk away. That's what it feels like right now. A provider also shared that claims have been denied since January. And then on the 1st of March, bam, they were hit, TRICARE hit reimbursement, cut reimbursement rates by 5%. I need us to really, really listen. This is the message my community needs to hear, loud and clear. Veterans are not pawns. They are not props, and they are certainly not charity cases. We are the backbone, and far too often, the sacrifice of this nation. It is our responsibility also as veterans to show up and make things better for the next generation of veterans, which leads me to the active duty folks that I've talked to this year. They are anxious, especially when men like Steve Bannon are tossing around talks of the second presidential power. This is leaving service members wondering if their next order will be ethical or survivable. And now, that rhetoric and the homogenizing of the military is pushing folks out of the uniform early. which will swell the veteran ranks while they gut the system meant to support veterans. And if you know veterans like I do, you know that we don't passively have frustration. It's kinetic. What we see happening is an attempt to leave Americans, and this is what I've heard from veterans. This is an attempt, it feels like an attempt to leave America and American people broke, the American spirit and its support systems broken, and the very people who swore to defend it brainwashed. But there's something that I have, and I think I hold in talking to veterans, is that they are bold, they are brave, and they don't back down from bullies who fumble classified material or common sense. So I ask, as we take this testimony, we realize that veterans are watching and they are ready. They want to be mobilized. They want to hold people accountable from Norfolk to DC. So let's say this plainly. America's veterans are America's commitment personified. And our service demands accountability of this administration. Those with power to make change, do your daggum job. Honor your promise or get out of the way. Because our watch is ongoing. I hear that consistently. And our service deserves nothing less. Thank you.
Thank you, Delegate Glass. We're also joined by Susan Hippen, a proud Navy veteran and retired Master Chief Petty Officer. A longtime resident of Virginia Beach, Susan has over 25 years of active duty service in the United States Navy. In her time in the military, she was one of only 3 women Master Chiefs at her naval station, Naval Air Station Oceana. Susan was previously appointed to the Virginia Board of Veterans Services and has spent much of her time after the military advocating for policies that improve the lives of Virginians and their families. Susan, thank you for your leadership and for being here today, and you're recognized.
Thank you, sir. You stole some of my thunder, but thank you. I appreciate that. Yes, I am a retired Navy Master Chief, and I am also an Air Force veteran. I am a Gold Star widow and a disabled veteran. My mother worked at the Cleveland and Philadelphia VA hospitals, so I have been around the VA a long time. I am here today to share my concerns about the way veteran services are being hacked away with careless, unresearched firings of employees. Veteran services in Hampton Roads region has been an issue for some time. I know the Senators Warner and Kane and Representatives Scott and Luria have worked to add clinics to Virginia. Congresswoman Keegan's staff did assist me recently. The cuts to VA staffing I have observed are detrimental to veteran services. Appointment clerks, gone. Patient clerks are now scheduling appointments. The community care office is severely understaffed and still using faxes. Doctors are overburdened. Provider staffing is so low that specialty clinic appointments are unavailable for weeks and months. Please understand, I am extremely pleased with my care provider. He is compassionate, considerate, inquires about my issues, and I know that he truly cares about his patients. And I have no complaints about any care provider or technician. Once I get an appointment, I receive outstanding care. As a retiree, I once used the branch medical clinic at NAS Oceana. However, reductions in staffing and operating hours made it difficult to use that clinic. Obtaining appointments could take days. Urgent care appointments are next to impossible to get unless you are on the phone at 7 a.m. in the morning. Yes, I served 2 terms on the Virginia Board of Veterans Services, and there I learned how Virginia and Federal Alliance benefits veterans. So I am acutely aware of how veteran services have evolved since my retirement. We have come a long way, but those gains are being chopped away. I attended the opening of the Chesapeake Clinic. I was disheartened to see that Congressman Scott was not a featured speaker for the clinic opening in his district. Congresswoman Keegan's was. By the way, radiology has not opened in that clinic yet. So if I see my doctor there, I have to go up to Hampton to get an x-ray. A skeleton staff operates that clinic. This is wasteful. I have watched some of the hearings on the VA, and I dislike how our services, or the lack thereof, are used as political footballs. And I want to state, expressing my concerns about the careless dismissal of the people who provide our care, process our claims, or assist with benefits should not be referred to as political fear-mongering. It is a fact. Workers who process the vouchers for homeless and adapted vehicles, gone. That benefit goes unused despite having funding. Medical specialists, undermanned. Mental health appointment waits are months long across the country. I am one of 5 veterans in my immediate family. 3 in Virginia Beach, 1 in New Jersey, and 1 in Kansas. Supply clerks, dismissed. And wasting employees' time with a weekly email about their accomplishments is not only counterproductive, but bad for morale. So I have 3 suggestions, because as you know, a Navy chief never comes without solutions. Number 1, toss the fixed number of employees to be eliminated. Number 2, staff clinics with providers at or near 100% and reduce the community care. Number 3, my pet peeve, stop using contract doctors to re-examine veterans who are submitting disability claims. Military doctors already diagnosed us. The Veterans Administration, like other government agencies, is a service. It exists for those who served our nation in the military. It is not a for-profit entity. The promise to care for veterans dates back to Abraham Lincoln. And he stated in his second inaugural address, and I quote, "To care for him who shall have borne the battle, and for his widow and his orphan," unquote. And on March 3rd, 1865, Lincoln signed legislation that established a network of national facilities to care for the nation's wounded, thus beginning our Veterans Administration. In closing, our nation has sent members to many wars. It should not scrimp on the care it gives to those who signed a blank check with our lives to protect us and our allies. Thank you, and I hope you enjoy being in the home of the Atlantic Fleet.
Thank you, Susan, for your testimony. We are joined next by Freddie Mejia, Policy Director at the Commonwealth Institute, an organization that works with leaders across Virginia to improve health care and make life more affordable for 8 million people who call Virginia their home. At the Commonwealth Institute, Freddie works with leaders to help remove barriers and red tape to Medicaid and ensure that more Virginians have access to the health care they need. Freddie, you are now recognized.
Thank you. Good morning, everyone. And thank you to the co-chair Barragan for the introduction. My name is Freddie Mejia, as you heard, and I'm the Policy Director at the Commonwealth Institute for Fiscal Analysis. It's a nonpartisan, research and advocacy-based nonprofit located in Richmond, Virginia. We all know that Medicaid is a critical safety net for millions of kids, adults, and older adults across the nation. What can sometimes be missed is the role that Medicaid plays in offering affordable and comprehensive health coverage to our military veterans and their families. Virginia is home to over 600,000 military veterans. The Commonwealth Institute estimates that Medicaid provides coverage for nearly 1 out of every 13 veterans in Virginia. That's roughly 47,000 people. We can safely assume that a large portion of this number lives not too far from here, in Norfolk and the Hampton Roads region in Virginia. These individuals may be adults working low-wage jobs, living with a disability, battling a long-term illness, caring for a loved one at home, or in between jobs, just like hundreds of thousands of individuals in Virginia who access coverage through Medicaid or Medicaid expansion. As we discuss the importance of policies and investments needed to ensure that our military veterans and their families have what they need to thrive, recent GOP legislative actions have threatened the Medicaid program through over $700 billion in funding cuts, as well as the erection of new barriers, new out-of-pocket costs, and additional paperwork for many veterans when applying and redetermining their health coverage through Medicaid. The Big Beautiful Bill, as some refer to it, although I heard a different name here earlier, it would require anyone who gets coverage through Medicaid expansion and earns above the federal poverty limit to pay up to $35 to access certain health services. There are no exclusions for this copayment for military veterans, and it could take up critical resources that would otherwise be put toward food or other basic needs. New work reporting requirements could deny coverage for veterans on Medicaid expansion unless they are able to complete and submit paperwork proving their employment or that they have a disability or caring for a child or a disabled adult. Finally, everyone on Medicaid expansion will be required to undergo eligibility checks every 6 months instead of once a year. That is twice the amount of paperwork and more opportunities for administrative issues to hinder the ability for people to keep their coverage. Again, there are no exclusions for this additional administrative burden for military veterans. I do not doubt that these new barriers to coverage will cause veterans who should be eligible for Medicaid coverage to be pushed out of the system and to end up uninsured. Thank you once again for the opportunity to speak with you. I encourage everyone in the audience, as well as listening today, to stay engaged and raise awareness about these threats to veteran health as the bill makes its way through the U.S. Senate. Thank you.
Thank you to all the witnesses for your testimony. I have a couple of questions. I'd like to start with Dr. Elliott. First, thank you for your service to veterans over the years. And in full disclosure, I do get some of my health care through the VA, and I'm very happy with the health care that I've received. I just want to make sure it's there for a long time to come, not only for me, but for my fellow veterans as well. And it seems pretty apparent to me with these cuts and the way that this administration is treating the Veterans Administration, there's a plan here to privatize medical services for veterans, to take it away from the VA and turn veterans over to the private sector market. And for the record, I want to say that in my entire time in Congress, representing many different districts that make up just about all of Northern California at one time or another, never once has a veteran come to me and asked me to privatize VA health care. Never once. But that seems to be what's going on right now. And I think it's important to note this is happening at the same time that this administration is devastating health care. Their cuts to Medicaid and subsequent cuts to Medicare as a result of their Medicaid cuts is going to take health care away from almost 14 million people. And it's going to either close hospitals, clinics, and rest homes, or it's going to severely limit the services that they can provide to the community. So what does that do to veterans if they're privatized out of the health care that they get now, turned over to a market that is going to be drastically shrunk? What happens to our veterans?
Sir, I'll tell you, this transfer of veterans to community care, and Ms. Hippen, you hit the nail on the head. is not new. Back during the first Trump, we started seeing more transfer of care out of the VA. And a lot of veterans flocked out of the VA to the community, thereby competing for the same appointment slots that the non-veterans were getting. Plans to reduce services at our VA are not new. It's been going on for a long time. And as I said, I've been in my union office for 35 years. And I will honestly tell you, back to George W. Bush, there was this move to just privatize everything. And when I went to see my director at that time, the only people who were inherently governmental were managers. No direct care people, no support people, no boiler plant operators to keep the heat on, none of them, no plumbers, none of them. Everyone else could be contracted out. So, sir, it is not new. My husband is a service-connected veteran, and he's been very happy with his services. And we want to see that continue. But with shortages of professionals, I'm a pharmacist. It's my understanding there's a pharmacist shortage. And there are moves underway to try to improve that, through the various schools and everything. And VA needs to be taking a proactive approach, not just for pharmacists, but for primary care, for mental health, for surgery, for all of our services. And so that's one thing that I believe needs to take place at the point when that can be done. Right now, it doesn't seem to me that DOJ and the administration really care about that. All they want to do is reduce the staff, hook or crook. It does not matter to them. And therefore, it adversely impacts our patients, our veterans. And I call them my patients. When I'm clinical, those people are my patients. They're not my clients. They're my patients. And if I need to call them from home, I do so. Whatever I need to do to make sure they get what it is that they need. And so it's very hurtful to me to have seen the gains that we have made, but to see someone with a chainsaw come in and just buzz it down is not right. It's not fair to anybody, the taxpayers, whether they're veterans or not, the staff, and most definitely the veterans who served our country to save and maintain democracy all over the world. Thank you for that question, sir.
Thank you
I'm
very
sorry
much.
I'm a little long-winded.
No, your passion is appreciated. Thank you. And I think it's important just to point out, and I mentioned it in my opening comments, about the crisis hotline that was passed by an act of Congress. And I had a veteran in my office just a couple of weeks ago who told me that when he calls in to the crisis hotline, having someone answer that phone on the other end is just as important as seeing a doctor.
That is correct.
Master Chief, I have a question for you. You work in the community. You advocate on behalf of veterans and other community issues. What are you hearing from Virginians about Donald Trump's mass firing of veterans who are working in our federal government? I know that I've had a number of veterans events since this all started to happen. I've gone to rallies with veterans. I had a town hall last week just for veterans, with veterans, and I'm hearing they're demoralized, they're frightened, they're scared, they don't know where to turn. What are you hearing?
Well, sir, it's not just the veterans. It's also the people that are working at the VA caring for us. They're worried about that. I have a family member that works for the VA as well. And I am concerned about that person's job. And I'm not going to say gender aware because for fear of retribution. We are all very concerned like I said, I went to the Chesapeake Clinic just to take a look after the ceremony. It was like a ghost town. It was very concerning to me. Like I said, I go to see my doctor who is now at the Chesapeake Clinic. If he says, Susan, I want you to get a scan for this. Susan, I want you to get that x-ray. I got to go all the way up to Hampton. People are scared, they're concerned, and they're pissed off, very honestly. Because again, we signed a blank check for our lives to provide the protection of our nation and our allies. And it is not right for someone to come in and think it's funny, okay? They think it's funny to cut services. But the very people that are caring for those folks that think it's funny to cut services are the same people that are supposed to be caring for us. It's just wrong. And like I said, people are pissed, they're scared, they don't know which way to turn.
Thank you very much. Yield back.
Thank you. Dr. Elliott, of all the extreme attacks that Donald Trump and Republicans in Congress are making to Americans' hard-earned benefits, there's one that particularly troubles me, and that's their unjust attack on veterans' health care. How has Trump's hiring freeze and service cuts at the VA worsened veterans' quality of care? And one thing, even though we're all Democrats sitting on the stage, it doesn't matter if the veteran, as I've discovered, is Republican, Democrat, Independent, or didn't vote. The chainsaw doesn't know that, and everybody has been affected.
Okay. Thank you for that question. What you're talking about, I guess, is the freeze. Am I correct?
Mm-hmm.
Well, when the freeze took place, HR human resources people had to contact everyone that was supposed to come to the incoming new employee orientation that next week to tell them that, I'm sorry to say, your job is frozen. Do not report. Your job offer is rescinded. So that's what they had to do first. I believe that particular week, if I recall correctly, there were about 25 people on that list who were supposed to be coming in. The majority of them were supposed to be going over to the North Battlefield Clinic. They were physicians, they were nurses, mental health providers, all various employees. After they did that, they had to go online to remove all of the job announcements that were current and could not put anything out until we received some sort of exemptions. We've been through 3 exemption lists. They've gradually increased, but they still don't have everybody on them. And so it's been an ongoing battle. And I will say that our leadership has put in for requests to exemptions. But when you're talking to people who neither care, they definitely don't know what healthcare people do. If I'm talking to someone who's maybe 21, 22, they don't go to the doctor really. They may not have any conception of what it takes to be a healthcare provider, to need healthcare. They don't care. And so therefore, our lists are not really all-inclusive. And so that's what HR has been doing double time, trying to just keep things going. But yes, there were people who decided they were not coming to the VA. And I couldn't blame them because there was a move against probationaries. So if you came, okay, I'm going to give you an example. We had a young man who came from a hospital here in the area to be our health and safety officer. He came around November. By December, it was December. By February, he was dismissed because he was probationary. Now, he's the health and safety officer for our facility to make sure that our facility is healthy, is a healthy environment for the veterans and our staff. That's unconscionable. That's just one example. So have I answered your question?
Leads to the worsening of the quality of care
That
for
is
veterans.
right. That is right.
You can't help it.
And the kicker about it is that in a situation, hopefully he's on that list. I haven't looked for his particular job announced, his job. But if he's not on that list because he's probationary, if we have a RIF, probationers go first. If they do it the way it's supposed to be done in accordance with our contract. We don't anticipate that they're going to do it in accordance with our contract because Donald Trump has already signed executive orders dismissing our contracts.
Right. Thank you. The reality is that Donald Trump isn't just going after veterans, as you know, veterans health care. He's also plotting with Republicans in Congress to cut Medicaid and food assistance. 215 House Republicans have already voted to approve and endorse a plan that will kick almost 14 million people off of their health care. Freddie, TCI and your partners are working to expand health care coverage to more and more Virginians. How will cuts to basic needs programs like Medicaid and SNAP disproportionately harm veterans?
Yeah, these cuts that are included in the GOP proposal are really devastating to the healthcare environment in general. But when we're thinking about our veteran population, we see a high instance of substance use disorder, or there's also mental health concerns that may arise, and essentially you're cutting away access to health coverage and to those critical services. And that goes for everyone, not just veterans, but we know that these cuts just also mean that there's a lot less money in the state budget to go towards further investments. We know that the federal costs involved here are really top of mind, but when we're talking about cutting SNAP, and that's hundreds of millions of dollars to Virginia's budget. And as we continue to advocate for easier access to health services, to make sure that there's a great pipeline of healthcare providers coming up through our college system, we need every cent. And we're talking about hundreds of millions going away in order just to provide for what we currently have in SNAP. So, these cuts are devastating to veteran families, to Virginia families, to the nation as a whole.
Thank you. Dr. Elliott, you mentioned hiring freezes. Are there still some positions that are subject to the hiring freeze?
Yes, sir.
And how is that affecting quality of care?
The demoralization of our staff. We were able to get some, and I have the most current list of exemptions, and I noticed that there were more of the people, like the boiler plant operators, who keep the building warm. I mean, that's, at first the list didn't even have the food service people on there to serve the food to the veterans who are in the hospitals, who are in the nursing home, who are in the dorm. They weren't on there. I mean, that's the nonsensical nature of everything that's going on. But yes, there are still positions that are not on the list. A lot of our leadership are not on the list. We can't run a hospital without leadership.
Thank you. Ms. Hippen, you mentioned the services that were not there at the Chesapeake facility. Can you tell us, there's a thing called PACS. Can you tell us, describe how they're staffed?
So the PACs are the patient care teams, and there are supposed to be 27 or 28 of them at the Chesapeake Clinic. I visited the clinic just to walk through because another veteran told me, man, it's like a ghost town in there. And I thought, oh, that's probably an exaggeration. I walked in there. There's one person when you come in to greet you. Okay, I can deal with that. But there are only 9 functioning PAC teams or patient care teams right now at that clinic.
And
9.
Each team has a physician, a few nurses, and
physician, PA, pharmacist, social worker, and somebody else.
And they have a patient load of so many.
Yes.
And as you increase the number of PACs, you can increase your patient load.
Correct. And right now, I was told by a veteran that she was not allowed to shift to the Chesapeake Clinic because she was not 100% disabled.
Their services, you mentioned x-rays are not provided. What about dental care?
I don't know that there are any. I walked through there. I know mental health care is months out for an appointment. There's no optometry clinic open. And part of the reasoning for my visit there is because I still have 2 appointments up at Hampton. And I said, well, I live within 10 minutes of the Chesapeake Clinic, so let me get my mammogram moved down there. Let me get my eye appointment moved. And that's how I found out that the clinics are not open.
And these are services that the clinic is prepared to provide as soon as it can get staffed up. Is that right?
Correct. Well, some of the equipment, I was told, is not there because I asked questions. And I was told that, well, I just saw this piece of equipment pulled in the other day and so on and so forth. That clinic has been planned for a long time. And there is no excuse other than cutting corners and playing games with people's lives. There's no excuse for us not to have radiology. There's no excuse for us not to have dental. There's no excuse for us to have mental health appointments that your first intake appointment is months out if you can get it. That's just unsatisfactory and unprofessional. But that's what we have.
Thank you. Mr. Mejia, you've mentioned the cuts in Medicaid and mentioned paperwork. Some have said that there's actually no one is being cut from Medicaid, and yet CBO scores that as 7 million people will lose their coverage. And I think you went through that a little bit by showing what happens if you're in a nursing home, obviously clearly eligible, and your doctor is on vacation when some of the paperwork is due. What happens to your Medicaid if the doctor's on vacation and the paperwork doesn't get done?
Yeah, this is the most troubling outcome that we fear. Individuals who are going to access their appointments to go pick up their prescription drugs and realize that their Medicaid had lapsed due to no fault of their own. We also know that Medicaid, people who have coverage through Medicaid often are housing unstable, so they may switch different housing even within the matter of 6 months. So if we're asking people to mail things, if we're asking people to submit documentation, we're thinking about rural areas that have limited internet access. These are all barriers that can really start to pile up, and in that example, the individual would lose coverage, would have to try to fight to try to get their coverage reinstated. But in the meantime, there are critical gaps in health coverage and health services, and some people may be discouraged from the process altogether. We also know that there are several exemptions for this work requirement, but oftentimes people in the community aren't looking at the fine print like we are. They hear about their cousin who got kicked off of coverage for not being able to provide this paperwork, and they think maybe that applies to me. So a single mom who should be excluded from this work requirement understands from just the experience in the community that there's barriers to coverage and decides not to enroll. So this is the impact of these new administrative barriers, and overall this is how we get to the uninsured number, which really is what underscores these federal
and things
savings.
Like the boss hasn't filled out the paperwork to show you are employed, or things like that that are not your fault. And this has been this work requirement has been inflicted on people in several states, and based on that experience, Medicaid can predict it's about 7 million people will lose their insurance. So when people say that no identifiable person has been had Medicaid ripped away, that may be technically true, but this paperwork, when the dust settles, 7 million people will lose their insurance because of that paperwork requirement. And so when they say nobody's losing their insurance, that's fine until somebody's boss doesn't fill out the paper, doctor goes on vacation, or some other glitch happens and they lose their insurance. And CBO has estimated 7 million people are going to fall in those cracks. Appreciate your testimony.
Thank you.
Thank you. I would like to also thank you all again for being here today. Delegate Glass, I want to follow up with you. You made some comments and told some stories about the lack of reimbursements, and we've heard today about what's happening to our veterans. You're a leader here in Virginia. Can you talk about what the delegates are feeling and how some of Virginia's leaders are doing or what they're maybe working on to soften the blow of Donald Trump's attacks on veterans' health care?
Gratitude, Congresswoman. I think it's important to understand is that we can't hold it all.
That we can't what?
We cannot hold it all, right? What has been happening is in Virginia, we've kind of made our own little bit of mistakes of how we hold veterans in hand. And we are sort of correcting those things to ensure that we are a place where veterans want to live, work, and play. But when you look at the size of our population here, as a legislator, we hold that in our hands. And I think it's also important to say this. Virginia has the highest number of women veterans in the country. And unfortunately, in these conversations, especially as it pertains to health care, they are so invisible. The standards, the care is so substandard. So take it a couple steps lower as we talk about the care for veterans and add that onto it, being a woman veteran. What we are thinking about is what will that look like? We offer a lot of programs. We offer a lot of opportunities because of the veteran population we have here. But what can we sustain? There are real conversations about what we're able to do. And unfortunately, like I said, most of those conversations go back to healthcare, job security, which are all of the things that are under attack that, for the most part, as a state-level legislator, there's not a whole lot I can do. The same support services that I would send someone to if they were looking for a job or looking for food, those are being lost. Right? These tertiary services are disappearing in front of our eyes because they're losing funding or they don't know if they're going to last through the year. So I think most of the conversation is how do we be good resources as we consistently lose them? How do we take care of families because we're losing educators, we're losing social workers, we're losing these people that stand by the sides of the veterans that support our community. So we have a tough road ahead of us.
Well, thank you. And I want to encourage you to continue to share stories. I'm sure maybe your office gets calls of stories of what's happening to our veterans, to share those stories with us, of course, on the national level so that we can continue to share the impacts, these negative impacts that our veterans are experiencing. Ferdy, I'd like to come back to you. You're an expert working to improve health care across Virginia, and just see if you have anything to add on what you're seeing leaders in Virginia do to try to soften the blow of these attacks that Donald Trump is having on our veterans.
Yeah, thank you for that question. So our House and our Senate both set up independent committees to try to anticipate and review the impacts, multiple different avenues and angles of the impacts of the Trump presidency, as well as what we're looking at in the GOP passed bill. So they're reviewing workforce, they're reviewing healthcare, they're reviewing our budgets, and really just trying to anticipate and stay one step ahead of what's going on. But as I'm sure you all know, it is very unpredictable. Things are happening very fast. My mom said, she used to tell me nothing good happens after midnight. This bill was, the cuts happened at 1 a.m., right? So while the state legislature is really trying to set up and anticipate some of these issues, there's so much unpredictability, even at this moment, that we're just kind of constrained. And what we are asking right now is at the federal level for everyone to do what they can in order to mitigate these cuts and harms. And at the state level, we're just asking that if there are those cuts, we're looking at those SNAP cuts, right, to really try to invest as we can. And that may mean raising revenue. Because we cannot cut at this moment when our families are in desperate and have been in desperate need of things like food access, healthcare access. So that's how the state is responding, and that's how we would like for them to respond moving forward.
Thank you. You're right. Nothing good happens after midnight. I like that. Susan, we want to close with you. We're seeing our veterans are facing extreme service cuts at the VA, they're losing access to civilian job opportunities in the federal government. What would you say to Donald Trump if he were here today? Yes, think about that.
Okay. What would I say to him? And I cannot speak like a sailor, I understand. I would say to him that you talked about being a veteran-friendly president. Mm-hmm. You have used us to get to where you are. And as I was once told, the toes you step on the way up are connected to the behinds that you have to kiss on the way down. His freedom to say and do what he does are because of people like Jackie and I, mm-hmm. and my husband, and my nephews, and my brother-in-law, and my nieces, and a whole lot of other people, and a guy named Ed Cass who died 2 weeks before the Theodore Roosevelt came back home. He is allowed to do and say a lot of the things because of those people. So don't disparage us and don't deny us what we were promised by Abraham Lincoln. This is not, again, like I said, my mother worked for the VA in Cleveland and in Philadelphia. When I was in middle school, well, we called it junior high. When I was in high school, and after, I know how the VA has gone up and down, and we were on that upslope again. And now it's like he just doesn't give a rat's hind end about us, and that's not right. So to him, I would say, there's got to be somebody that you care about besides yourself. Make it the people that gave you the freedom to say and do the things that you do.
Great. Thank you so much. We'll turn it over to you, Bobby.
Thank you. In closing, let me just remind people of the quote from attributed to President George Washington. He said, "The willingness with which our young people are likely to serve in any war, no matter how justified, shall be directly proportional to how they perceive how veterans of early wars were treated and appreciated by their nation." So we owe it to our veterans to provide the health care they need. Not only is it the right thing to do, it's a national imperative. So I want to thank my colleagues for traveling to Hampton Roads to discuss veterans' health care, and to our witnesses for bringing important information to our attention. Robin?
Thank you. So as the co-chair of the Steering Policy Committee, as one of the co-chairs, I have the honor of closing out this hearing today. House Democrats have taken our fight to protect Americans' hard-earned benefits, from the halls of Congress to town halls across this great country. We are meeting with families, listening to our constituents, and holding important conversations with leaders, just like the one we convened here today. We are not afraid to fight against Donald Trump and his Republican attacks on our veterans, because Americans, veterans, deserve better from Washington. If only House Republicans could say the same. They're either cowering behind Donald Trump or complicit in his extreme agenda, cutting Medicaid and food assistance, firing veterans from their jobs, and weakening the VA. We won't stop speaking up and fighting back on behalf of the American people and the veterans who served our nation proud. This meeting of the Steering and Policy Committee is hereby adjourned.